there are a number of projects that have been developed. In fact, I must say that since 2017, thereabout, a number of projects have been developed. And like I indicated, there are scholars that have done excellently well in the country, and we want to appreciate what they've done. And it's a motivation to the entire health system. And like as a participant asked, yes, we can share some of the details. And fortunately, we have some of the scholars who carry out some of the projects in the room. Adam Anas, I saw him in the room. Myself, Obed, who undertook a project to we are here. So any of the projects that you want us to share, will give you the details of how these projects were implemented and how it turned out. So any of the projects, yeah. So maybe if they can be specific on how, or specific projects that we should share the details. Fortunately, all the scholars are they are in the room. We can share the details.
Can I ask a question of it?
Yes, do, please.
Thank you. Thank you, Obed. So I just asked to join this plenary because I have a question. I was following this presentation, and I really appreciate for the wonderful presentation, a wonderful project implementation, and wonderful impact from the project. I was really impressed by the result you have achieved, Ghana team. I want to congratulate you all. So my question was, I was very impressed with the impacts with the number of implemented projects. So were you managed to finance these projects from partners or whatever, or this implementation were completely done by like willingness, by commitment? How would the implementation, please? I think Obed has left the.
I think, Obed, if you have just left the panel, please ask to join the panel again. And thank you very much, Fitwi, for that good question. I think we're all very excited by what Obed shared during the plenary, really the scholars' projects, the difference that it has been making. And we're seeing many interesting questions in the chat as well. So Obed, if you're still in the panel, please unmute. This is really a panel where, yeah, so I see you're back here. It's great. So did you catch what question we asked, and would you like to respond?
Sorry, yeah, I think, I don't know whether it's a network challenge. It was just some few minutes, I think I went off. Please, if you could help me with the questions once again. Sorry.
Yes, no problem. So I was appreciating for the wonderful implementation of your project, and I was asking whether these projects were financed by someone or any other partner, because I have seen a very good outcome impact from the project. So who were besides you, were they financed? Can't you hear me, Obed? Yes, Hilaris. I think the connection from Obed is not good.
In this case, Fitwi, I invite As Obed mentioned, there are many Ghanaian scholars in the room right now with us, in fact. So I invite, if you are a scholar from Ghana, that question from Fitwi, how have you funded the project implementation that you have done, whichever project you did? And Hilarious, I thought I saw you wanted to comment. Would you like to respond to Fitwi if you are one of the Ghanaian team members?
Yes, I am. Right. So
Great.
I don't know if you hear me clearly. Hello.
Yeah, we can get you, Hilarious. Would you like to maybe explain a little bit what project you implemented and then how you funded and implemented, you know, the project that you developed during one of the scholar courses?
Yes. Hello, Ja. Hello, Ja.
Yes, Obed, we're
Yes.
inviting Hilarious to share his experience. You may
Okay.
be having some connectivity issues.
Yeah.
But,
Okay.
try your best.
So for my project, I was looking at how we could immunize services to pre-COVID levels, and this did.
I think they are both out. TJ left. If the rest of the team here can react.
Exactly. Thank you, Fitwi. Obed and Hilarious, two of the Ghanaian team members may be having some connectivity issues. As we wait for them to rejoin us, I invite the Ghanaian team members in the room to step in and respond to the questions that you see in the chat. And if you would like to join the panel, please ask to share audio and video so that you can join us. I see Obed is back.
Yes, he's back. If he can manage to speak.
Hello, Ja.
Yes, Obed, you're back.
Yes, thank you very much. I think it's a network connectivity issue. I think it's clear with the challenge we indicated that we have connectivity issues. I implemented a project when I was in one of the districts, that's Swaman district, the North region. And that project has been completed. We use the idea of missed opportunities to ensure that we vaccinate all pregnant women that are coming to the health facility. We realize that all the services that are rendered to pregnant women are very high, 90% and above. But when it comes to TD2 plus coverage, it's either 51.8% or lower than that over the past 4 or 5 years, that is before 2018. So steps were taken, and this training that we had from the scholar course helped us to come out with the ideas. Then we saw clearly that the pregnant women that come to the facility are seen by midwives, and these midwives do not vaccinate pregnant women, but the vaccination is done by community health nurses. So from the point where they refer them to the reproductive health units for them to be vaccinated, missed opportunities occur. Then we train them to do the vaccination at that level. We gave them vaccine carriers. We went ahead to make sure that we provided them with EPI tally books because they were not having them. And so when they come to the facility and after providing the other services to them, then clearly they are able to get the vaccination that they needed. And we did that by monitoring this performance every week on a WhatsApp platform. We developed a form that we use to track all the vaccinations that have been done. Yeah. So that is how we did. And at the end of the year, we're able to get that far. But I must say that those who will be implementing such projects, we went far back some of the months trying to look into their registers to see those pregnant women that have not yet delivered but are still in the health facility and have missed 2 or more doses. And when we had them, we vaccinated them, and that improved the coverage that we saw. Thank you very much. Yeah.
Thank you, Obed. I see that.
Yes, Obed.
Yeah, Benson, you have a question?
Yes. I have a question, and I'm really impressed by the work these guys in Ghana are doing. And my one question, which I have just posted in the chat, is that can you give us maybe 2 or 3 strategies or innovations that we have used to get the impressive coverage results? For example, in Mambruzi district of northeastern region of Ghana, I think that's so impressive, and I will be eager to learn. How are you yielding these results in a span of 1 or 2 years and getting to that level of coverage? For example, in MR2, can you just give us some strategies, 1 or 2 in a nutshell? How do you achieve these results? Because for me, it's a good learning lesson that I can be able to implement in my country, Kenya. So, Obed, are you there, or who else can be able to help us get
great? I think Adam announced is in the room, I'm sure. He should be able to respond, but if he's not, I think he has given me some of the things that he did clearly. But in my case, we realize that stakeholders' engagement is very key, from the directorate where we work to the facility level. Because when you are not there, the project should not die. It should still continue. So we realize that we run a lot of programs, but we don't bring people together to understand the concept of the project and where we want to get to. So I made sure that they were fully involved. Everyone at the district health directorate was involved. The district director was even took the whole project and has been communicating in everywhere he goes. And the next one was the people that will actually implement it at the facility level. These are the midwives who does they see the pregnant women. We were using missed opportunities. That strategy was used in 2019 when we employed it. They see the pregnant women and they are left to go. So we decided to involve these pregnant women, train them, teach them to be able to vaccinate. And we went there practically to see that they are doing it. And they report on their own page the number they vaccinated every week. And we're monitoring it for the entire period. That resulted in it. And in fact, I must say that at the end of the year, we really appreciated what they did. Motivation is very key. Thank you very much. Yes, I've been notified that Adams is in the room, so Adams will be able to respond to West Mamprusi.
Okay, thank you very much, Mr. Obed. I hope you can hear me.
Yes, loud and clear.
Okay, thank you very much. So for Northeast region, I think 3 very key strategies in improving coverage of MR2. Number 1, leadership is very key. And then Mr. Obed already spent a lot of time explaining how the district leadership took over the project to ensure that we really achieve results. The second one he also mentioned has to do with stakeholder engagement. And this has really given us a lot of results, because what we realize is that the candidates for MR2 were mostly found in the schools, the kindergartens. And so if you go to the community during the school days, you will not find these children. So we needed to collaborate with the Ghana Education Service to ensure that we open vaccination centers in all the early childhood development schools to ensure that we are able to catch all these children and then vaccinate them. So I think that these are the three key objectives or strategies that has really given us the results that you have seen. Thank you.
Great.
Thank you, Obed and Adam. One question, sorry to bother you with these questions. And Obed said that there was kind of some motivation that was done, especially in TD2. What kind of motivation were you giving? Were you giving in a mandatory form? I would really like to know, because actually human beings are driven by motivation. But actually at times we ask ourselves, can we have motivation that's sustainable without the use of monetary? So can you just tell us how are they motivated to work?
Okay, thank you very much. Yes, with the motivation, we were very careful with it. In fact, when you are implementing such projects, you should look at the sustainability of the project, because there are some things when you start with, you will not be able to continue, and that will affect the success of the project. So we initially designed that we are, like you indicated, we are going to motivate them in terms of monetary, but after a larger engagement meeting, we saw that that will not be sustainable. So we brought them together and appreciated what they did. In fact, the facility that had the highest record of vaccination were acknowledged with, not with money. I think the director, I don't know, I saw the director in the room or so. In fact, we did not use money. We only gave them thumbs up and gave them a big hand applause. And it gingered the entire room that everyone is ready to move forward. We also tried to say that going forward, we are going to give them certificates, which will not actually cost us, get a certificate, and that shows that this facility has excelled when it comes to TD2 vaccination. These are the options that going forward we want to give to facilities that excel in the municipality or the district. Thank you very much. So no money was used in that regard.
Hey, can I have some questions?
But
yes,
Hello?
do please. Yes, please.
Okay, thank you very much, Obed, and the Ghanaian team from Sierra Leone. I see you have been working on immunization in the health facilities, particularly with regard to pregnant women and children. You are dealing with TD2 and MR. When we had measles alone vaccines, we found out that the coverage in Sierra Leone didn't go up to 85%. Bringing a mix of 2 doses, which better, in fact, further dropped the coverage. How have you been within these 2 to 3 years that Rubella was introduced? Have you been able to maintain or having increased the coverage to that? Then the next question is the fact that with TD2 plus having gone to 97%, the ancillary service of delivery, how have you been able to maintain it with that high coverage? I'm actually a member of an NGO called Focus 1000 in Australia.
Okay, thank you very much, Paul. I think a very quick one on that, that is the TD2 and that of the MR. I know Adam Anas is also in there, and Dr. Hilarious is also one of the scholars that implemented in that regard, so they respond. But with the TD2, you know, we realized that TD2 plus coverage basically the understanding by our healthcare workers is challenging. Sometimes the mother who has delivered for about 2 or 3 in the same facility comes back the following in the following pregnancy, and then they restart again with TD1. See, so the historical one is not known. So when we started the project, we decided to detail all the pregnant women that are coming to the facility. We started collecting it in an Excel template to be able to track it, and then we were now making plans to make sure that we use the software to track it. But the point I want to make here is that if the health care workers, especially the midwives or the community health nurses dealing with them, if that is not well handled, they will keep on duplicating all the time. And so you'll see that in a year, somebody who has about even 3 will come back, and then they will start TD1. If you don't monitor it, that is what will happen. So monitoring is very key to ensuring that you are able to achieve that. And you know, their registers, they are such that flipping back or taking historical other register to trace whether they had the vaccinations is quite challenging, especially when they present the facility with no card. It's very difficult. And so the only way you can now do is to start building from where you have started, so that subsequently you'll be able to address that. And for me, I keep on saying, the people that take care of the pregnant women are the midwives. So why should community health nurses in our country, for example, be vaccinating them? When that happens, you will not be able to get the yielded desired results that you want. And we believe that once we have done the training, we have sensitized them, now they've taken it upon themselves. Some of them are now even going to the extent that before the pregnant woman will leave the facility, they want to find out whether he has been vaccinated. And it's all because of that motivation, where we acknowledge them in the meetings and give them applause that has brought us this far. And we believe that going forward, that has been sensitized in the district already, and any staff that will move to different districts will continue in that same regard. So Adam Anas and Dr. Hilarious in the room, they will also handle that of the MR2. There are other scholars too that have handled MR2. Yes, Adam Anas.
Yeah, so Paul, if you can repeat your question on MR2 again, I didn't get it clear.
Thank you very much, Anas. I said before the introduction of Bella into the measles vaccine to be MR2, in Sierra Leone, our coverage for measles was not up to 85%, which we thought was our goal. Now, bringing rubella into that vaccine and having 2 doses definitely brought the coverage down. How have you been able to maintain your initial coverage of alone vaccine to a single dose to double dose of MR2?
So thank you very much. The introduction of the MR2 actually did not contribute to reducing the measles coverage, especially in the East Mamprusi district. Simple because acceptability of vaccination in the project area is very high. The only challenge that we had to do with how to get the children, and for that matter, the caregivers at 18 months, since most of them will finish their immunization schedules around the 11, 12 months. And so staying that long period and having to remember and come back for the second dose was a challenge. So we needed to devise a strategy where we can easily get these children. And so that is where we have to work with the Ghana Education Service to ensure that where the children are found, we are able to get there and then give them the second dose. And so that is what we have done to ensure that we maintain the coverage. Acceptability, as I mentioned earlier, is very high. So just need to work with stakeholders to ensure that we are able to get these children where they are found at 18 months to give them the second vaccine. I hope that answered your questions.
Thank you very much. But don't you think we needed to also give the vaccines to higher age children, particularly in the junior secondary school, primary schools, and the junior secondary schools? Because 18 months, we thought we in fact did a mass immunization up to 50.
Of age.
Hello, Paul is asking for clarification. How many years of age?
And when we did a mass immunization in the introduction of the MR2, we went up to 15 years of children.
Okay, so
okay, Adams.
Yes, so that is fine. If available research has proven that we can include that age and that will be effective, that is fine. But that also depends on the resources of the country. Because once you are widening the age or the scope, that means that it will call for more resources at all the levels. So to me, with the current level that we are in Ghana, I think that the second dose at 18 months is okay.
Okay.
Thank you.
Okay. And Paul, I want to also say myself and then my municipal disease control officer did something. We wanted to find out in the facilities what is exactly happening to MR2. So we made them to go into their own registers and look at children that have not been able to get the vaccination because of the pandemic. They went in and we told them, list all of them with their names. We want to come and support you so that we will vaccinate them. And they listed them. So I'm talking about the importance of tracking the immunizations that we do. We need to track. If we fail to track, because those who had the immunizations in the first year of life, they are the same ones we are continuing. Why is it that their own has gone down and then this one is high? Meanwhile, under 5 at CWC centers is very high. Why? What is there? Are there missed opportunities or what is the challenge? So it's all about tracking every month with them, not waiting until half year or annual. No, every month. And if you can even do, you go down to the weekly levels, tracking it on the digital platforms, WhatsApp, whatever, so that they report to you how many of these children are still left vaccinated by facilities and where are they, so that if you have any support for them, you provide the support and they will go and look for the children and they will be vaccinated and the coverage will improve. Thank you very much, Paul. I think that is so excellent from your end. Okay. So I want to find out if there are further questions that that we have not responded to, so that we can do that. I don't know whether Clement is in the room, but Clement is using the accompanist concept that we have in the WHO scholar program to carry out a project. And I think when it's completed, we'll get great stories from there. And it's working very, very well.